Hello my friends, my name is Dr. Syed Kazmi. Welcome to my YouTube channel, and in today's this small vlog video I'm going to talk about how do we use hyperoxia test to differentiate between congenital cardiac problems and congenital lung problems. Many times when neonates are born and either they have got defects in their hearts or defects or problems with their lungs, it is very difficult to differentiate between these two broad groups solely on the basis of clinical signs and symptoms, because they might be having tachypnea, tachycardia and other symptomatology which occurs both when they have got cardiac problems and can happen also when they have got pulmonary problems. So hyperoxia test is a very simple screening tool which can differentiate between congenital cardiac problems, especially the congenital cyanotic heart problems and the congenital lung problems. So what is hyperoxia test and how do we do it? Hyperoxia test is a test in which 100% oxygen is given to the baby or to the newborn by a facial mask. It is given for 5 minutes, and after those 5 minutes we take the readings of arterial oxygen saturation levels. Now before we start the hyperoxia test, we have taken the baseline arterial oxygen levels as well, and then we compare it after giving them 100% oxygen for 5 minutes. Now if the low levels of the oxygen are caused by lung problems, and if you give them 100% oxygen for 5 minutes, there is usually a marked improvement in the arterial oxygenation saturation levels, and usually this ranges between 100 to 150 millimeter of mercury. In other words, if you take the baseline oxygen saturation levels in the arteries, you give them 5 minutes of 100% oxygen, and you take the measurements after that, you'll see that in case of lung problems there would be an improvement of 100 to 150 millimeter of oxygen as far as their oxygen levels in the arteries are concerned. But if the underlying problem is cyanotic congenital heart diseases, then the increase might not be more than 10 to 15 millimeters of mercury as far as their arterial oxygen saturation is concerned. Now keep it in mind that when we have to do this arterial oxygen saturation levels, we have to do arterial blood gases, and it's an invasive procedure. So sometimes a proxy can be used in the form of blood oxygen saturation levels, which we do by putting up a oxygenation probe around the big toe or around a finger, and that can be used as a proxy. So if we take the levels before starting of the hyperoxia test and we compare it with the levels after giving them 100% oxygen for 5 minutes, in congenital heart problems usually the increase would be very less. Like for example, if somebody had an oxygen saturation levels of 86% and you gave them 5 minutes of 100% oxygen, these sets might only improve up to, let's say, 88-89%. So that goes more in favor of cardiac problems. But if there is an increase, let's say it was 86 before the start of hyperoxia test, you gave them 100% oxygen for 5 minutes, and then it went up to 94-95%, then it goes more in favor of lung problems. There is only one exception here, the only one lung condition in which the saturations do not improve, that is what we call as persistent pulmonary hypertension. And persistent pulmonary hypertension usually occurs as a consequence or as a complication of long-standing congenital lung problems, and is most commonly seen in what we call as meconium aspiration syndrome. So it occurs as a complication of meconium aspiration syndrome if you do not treat it. And as you know that meconium aspiration syndrome can be the feature of cystic fibrosis, or it could be feature of some other problems as well. So keep it in mind that persistent pulmonary hypertension is the only lung condition in which the hyperoxia test would not lead to an increase in oxygen saturation level in the arteries. Rest of all the cases, all the causes are cardiac in nature. But if there is an increase, that actually means that there is primarily a lung pathology. So I hope you have now understood the implication of hyperoxia test and how it differentiates between the broader groups of congenital cyanotic heart problems and congenital lung problems. Thank you very much. Bye-bye.